Everyone has a different healing time and response when it comes to healing their scars. Board-certified plastic surgeon Dan Delvecchio explains.
I think one of the biggest problems with wound healing and cosmetic surgery isn't the incision and the way the wound is closed, because as surgeons, we typically are very consistent about that. The real variability in wound healing is the way the patients heal.
Now there's a newly released product on the market that's been approved by the Food and Drug Administration, a topical silicone gel mixed with a topical steroid. It may be a solution for patients who have a history of bad scars or discover their new scar isn't healing properly. Dr. Brett Snyder, a board-certified plastic surgeon, says some people will know in the first 6 to 8 weeks if their scar isn't doing well.
If you're going along during your recovery and something doesn't seem right about the scar, by all means call your plastic surgeon and go in to see him, because he probably has some options for you to either get the scar to heal better or to improve its appearance in the long run.
Most scars heal with the usual treatment and wound care. Time, patient compliance, keeping the scar out of the sun, also well hydrated and clean. Others, mostly due to genetics, can form wide or raised scars.
If your surgeon discovers that the scar is starting to get thick or red or itchy, then we sort of have an algorithm of things we may do that can improve the appearance or any symptoms that the scar may have.
If you begin to have a problem, you might move to a topical steroid. If that doesn't take care of it, then you might use injectable steroids as well.
Dr. Lee Thornton says the science of topical steroid is less proven than injectable, but many patients would rather try a topical cream with the steroid first before moving to injections. It's well documented that the use of steroid injections can help with hypertrophic or keloid scars. Board-certified plastic surgeon Dr. Bill Adams says what's really important is that surgeons and patients follow a proven algorithm for scar therapy.
While products such as a topical silicone with steroid are a good option for a problem scar, they shouldn't be used for first-line scar therapy. Generally, starting out, we think of things like topical silicone sheeting, silicone gels, minimizing tension on the incision, pressure, and sun avoidance. If a scar appears not to be progressing as we want, that's when we would consider using a silicone gel with steroid.
Carolyn Grimes, The Plastic Surgery Channel.